Now it's time for you to do a med pass. There's things you need to do before you start the med pass. So the first video here is going to be talking about what you need to do in order to get ready to pass the meds, especially with your instructor, or even as you get into your own practice. So there are some things that you need to know specifically for your med pass. Whenever you go to pull your information or pull your medicines, you're going to need to be able to tell your instructor several things about the specific medicines. Because even as a nurse, you never want to give a medication that you don't know these things. Because when you give that patient the medicine, you need to know what to expect and to do it every time and to make a good practice of it. So the first thing you need to know is the medication, and is that dose appropriate for that medication? Because even doctors make mistakes, pharmacists make mistakes, and as I've said over and over again, as a nurse, we are the last check in hopes of preventing a medication error. So is that dose appropriate for that medication? You also need to know a diagnosis. Why is your patient taking that medicine? For example, Coumadin, which is a blood thinner. The other name is warfarin, which is your generic name. Some patients may take that for a blood clot in their leg. Some people may take it for atrial fibrillation. So you need to know, why is your patient taking that drug? You're going to need to know the classification of it. Is it an anticoagulant? Is it an antiplatelet? Is it a penicillin, a cephalosporin, a beta blocker? That's something you'll need to tell your instructor. Also, the action. What is going to happen? What's supposed to happen? And the opposite of that, what could be some side effects of it? So you'll need to be able to list important side effects, several for that medication. You'll also need to tell your instructor if there's a black box warning. That's something that is relatively new being added to drugs, and if your medication has got a black box warning, you really need to know it, because that means there's a higher risk for death for that medication. Also, teaching. You'll need to be able to do some teaching, or let your instructor know some teaching in case you get into your patient's room. And as a nurse, we have to educate our patients about the medications that they take. So you need to be able to teach your medications to your patients. So have you list 5 on your drug cards. So be sure that you're listing 5 and have that information, important things that you need to instruct your patient about. For example, do you have to take it with meals? Do you take it on an empty stomach? Do you need to avoid grapefruit juice? Some blood pressure medicines you can't drink grapefruit juice with. Do you not need to handle that medication with your bare hands as a nurse? Because there are some medications that if, as a nurse, of course, as a nurse, we never touch medications with our bare hands, but there are some that you have to wear gloves with. And for example, this is worst case scenario. There are some medications that if you are a pregnant female and you touch those medications with your hands, it can cause you to miscarry. So that is very important information that you need to know. Also, the lab monitoring, or what type of monitoring needs to occur. So that's something you'll need to be able to list to your instructor, and also be able to keep in the back of your mind. The first one that comes to mind for me is Lanoxin. When you give Lanoxin, you're going to have to monitor their apical pulse. You do not give it if it's less than 60. If it's 58, you do not give it. You have to hold it. Also with Lanoxin, there are lab monitoring that you have to do with that. The doctor will order a digoxin level, because patients can get toxic with it. Even antibiotics. Some antibiotics like vancomycin and gentamicin, they require what's called peaks and troughs to see how the body is processing it and able to metabolize it and excrete it. So the nurse has to watch the peak and the trough, because you have to keep a certain amount level of drug in your body for it to be effective. So certain lab works like that. So now we've told our instructor about all of our things that we have to know from our drug cards, so that's why you want really good drug cards. Then we have to also look, when we go to pull our medications, the expiration date. Any medication you give, you need to check the expiration date, whether it's on a pill or on a vial. Some medications, like insulins, once you open them, they're only good for so many days. For example, with insulin, you don't have to refrigerate it until it's opened. I've got that backwards. Whenever you have to keep it refrigerated until it's opened. Once it's opened, you do not have to refrigerate it. But they're not all created equal. Some insulins, once you open them, are good for 31 days. Some are only good for 28 days. Lantus, for example, and I think that's on a lot of our example cards, Lantus is only good for 28 days once it's open. Then it has to be discarded. Allergies. You need to look at your patient's allergies before you start pulling the medications, because again, we're the final check. Is your patient allergic to that medication? Can it be crushed or split? If your patient requires a dose that requires the pill to be split, then it has to be scored. You cannot, most facilities have protocols that say, and you're not supposed to split a pill that has not already got that little score line in it, because when it breaks, it may not break evenly. So be sure that you can or are allowed to split that medication, and you split them with a pill crusher that are not a pill crusher, a pill splitter that is normally on your drug cards. Can it be crushed? Not all medications can be crushed. For example, potassium cannot be crushed. If a medication cannot be crushed, then you need to ask the physician for a different form of it, like maybe a liquid, or does it need to be given IV? And gloves. Like I said before, when you pass a normal med pass, you do not have to wear gloves. You do have to do hand hygiene before you start. But you do not have to wear gloves to pull medications, because you are not going to touch them with your hands. If there's a chance that you are going to have to touch it with your hands, then you have to have a glove on. And again, some medications require you to have gloves due to that type of medication, and don't want to cause harm to yourself. Now we're going to talk about the rights of a medication pass. You have to always, always, always do your rights of medication. Let's count mine. 1, 2, 3, 4, 5, 6, 7, 8. I've got 8. The book talks about 5. There's even arguments in the nursing community if the 5 rights of MedPass is not enough. Some online list 10, 12, even up to 20 medication rights. But we're going to go over the basic ones. The first one, do you have the right patient? Seems simple. You always identify your patient with 2 identifiers, their name and their date of birth. And you always ask the patient, tell me your name. Get out of the habit of telling or saying to your patient, are you Miss Smith? Because if they're demented, they may shake their heads yes. So always ask, tell me your name and date of birth. Is it the right medication? So be sure that you have read it correctly and you have got the right medications. There are medications that are look-alike, sound alike. So you want to be sure that you do not have a mix-up going on. Like the generics of Xanax and Ativan are allorazepam and lorazepam. They look very similar, but they're different. So be sure that you have got the right medication. Is it the right dose? Again, you're checking to be sure that you've got the right safe dose for that patient and the dose the physician ordered. Is it the right route? If you go into a patient's room, or even if the doctor hasn't ordered a route, that has to be clarified. The doctor has to decide the route. You cannot take it upon yourself to change the route. It is physician ordered. The right documentation. When you finish, then you document that you have given that medication, and if there's been any issues. The right time and the right frequency. You want to be sure that you're giving it in the right time frame that has been ordered for that patient. Usually in acute care settings, you've got a 30-minute window. Say if the doctor orders something at 8 o'clock in the morning, then you've got between 7:30 and 8:30 to get that into that patient. If something's ordered twice a day, then it has to be spaced accordingly, usually every 12 hours or 12 hours apart, so 8 and 8. You cannot give both doses, at 8 in the morning and 10 in the morning. So you need to be sure that you're giving it at the right frequency that is ordered. If the doctor has ordered pain medication every 12 hours, then you cannot give the second dose 4 hours apart. You have to be 12 hours apart. Very important, the right to refuse. The patient has the right to refuse any care, even any medications. If a patient refuses, you need to ask them why and document why they refuse. And with IV therapy, which we'll be talking about in later videos, there's an extra one. There's an extra right, and that's the right rate. So are you running it at the correct rate for that patient? So this covers our patient rights. Of course, we're always going to do our AWIPes. We're going to announce ourselves. We are going to wash our hands. We're going to identify our patient, provide privacy, educate, and do safety.